Hello guys, now we'll be seeing a topic of meta-analysis, which is a very important topic for postgraduate exams in all specialities, and it will be helpful for all postgraduate trainees. So let's get started. So what is meta-analysis? So it's a highest form of research study. So here what we do is a systematic and objective way. We combine the data from many studies and it provides merged estimates of treatment efficacy and statistical significance. So we get a merged estimate of treatment effectiveness and statistical significance of the method. The studies used in these to combine are randomized trials, case control studies, and cohort studies, and the results are uh, expressed in the form of odds ratio and relative risk. So what is the advantages of meta-analysis? So there will be more sample size, so better analysis it will have. We'll give it a comprehensive understanding of the study, that is a big picture approach. We get a big picture of the research question. Then there will be more precision and less bias in the study. Also, it will help select best among the treatments, and we'll be able to take informed healthcare policy decision, better healthcare policy decision, and through the help of robust evidence. So these are the advantages. What are the limitation? So quality of this meta-analysis will depend on the quality of the studies used, like all the RCTs, cohort studies which we use. So depending on that quality of that studies, RCTs, it will depend on that. It will depend. Our meta-analysis quality will depend on the quality of the RCT used. Then coming third, second point is the publication bias. So there will be biasness towards the published study, so it will be more favored. Heterogeneity, so difference in study design and population will limit generalizability. So due to difference in the type of population or study design of different studies, it will be difficult to generalize the uh, results. So what are the common applications? So first is the treatment efficacy, as we have discussed, to assess the risk factor analysis, then take healthcare policy decisions and evaluation. Now coming to steps of doing meta-analysis. So first and foremost, we define our research question. What is our question? Then we'll make an inclusion exclusion criteria of studies. Then we'll do a comprehensive literature search from the database. Then we'll extract the data from the selected studies. Fifthly, we'll analyze the data with help of statistical methods. And lastly, we'll come to interpretation of our results. So for example, we'll take various studies, 1 to 20 studies, and we do a meta-analysis on effectiveness of beta blocker to decrease mortality in heart failure. So combined results, we will come to know that beta blockers reduce mortality by 25% compared to placebo. So to conclude, it is uh, the highest order of study from the pyramid of research, that is the evidence-based medicine pyramid. So meta-analysis has the highest clinical relevance and highest study of the pyramid, and it is the gold standard of the research studies among the research studies. It is the powerful tool to take informed decision, and it is based on robust evidence. Also, proper understanding of benefit and limitation, it will help us in improving the patient outcomes and healthcare policy. So this was all about meta-analysis. Now we'll be seeing some things on odds ratio, which was the way we get results in meta-analysis. So odds ratio, also known as cross product ratio or relative odds. So it is the strength of association between the risk factor and the outcome. So how strong is the association between a risk factor like smoking and outcome like lung cancer. It is an estimate of relative risk. So as per the table where we have case and control, and on the other side we have exposure to the risk factor and non-exposure to the risk factor. Based on this, we calculate the odds ratio where the cases were exposed is divided by control that were not exposed. So odds of the cases exposed and odds of the control that were exposed. So here we get a ratio of ADB by C. So to interpret these odds ratio, if the odds ratio is less than 1, it's a negative association between the disease and the exposure. So here the exposure is protective actually in negative association. So it will be helpful. If it is 1, then there is no association between disease and exposure. So there is no role. Then next point, if there is positive association between disease and exposure, then the exposure is harmful. So we have to consider that. Then this was all about odds ratio. Now coming to relative risk. So it is the ratio of incidence between the exposed and non-exposed, and it can be calculated from cohort or prospective studies. Again, we have disease and non-diseased one, and exposed to risk factor and unexposed to risk factor. So depending on that, we calculate the relative risk. So incidence of the exposed among the incidence on the non-exposed. So the formula will be A divided by A plus B, the whole divided by C divided by C plus D. So how do we interpret this? So if the relative risk is more than 1, then increased risk of outcome in the exposed, like smoking and MI. And if there is relative risk is less than 1, then risk it decreases risk or is protective, like exercise and diabetes. If it is equal to 1, there is no association, like lipoma and smoking. So this was about relative risk. Now coming to the last topic, that is attributable risk. So it indicates up to what extent the disease can be said that it is attributed to this risk. Then lastly, how is it calculated attributable risk? So here we calculate the incidence of the exposed and we subtract incidence of exposed from the incidence of non-exposed. So incidence exposed minus incidence of non-exposed divided by incidence of non-exposed multiplied by 100. So for example, smoking and TAO, the relative risk is 3.5 and the attributable risk is 0.72, that is 72%. So 72% of the risk can be attributed for lung cancer or TAO. So this was all about the relative risk, odds ratio and attributable risk, which is helpful for analyzing and understanding the meta-analysis because the results are in that form, and hope it will be helpful for exam going residents. And thank you for watching. Please like, share and subscribe my channel, and keep studying, keep growing, because great things take time. And see you soon in the next video. Never give up because great things take time. Thank you.